You've just had a total shoulder replacement. One of the precautions with a shoulder replacement is you cannot put any weight into that arm for several weeks. Now, if you're normally walking with a walker, that creates a bit of a problem, because when you walk with a walker, you're not going to be able to put weight through that arm, and you're going to be in your sling night and day. The only time you take the sling off is for your exercises and physical therapy and showering. Okay? So you're not going to be able to hold on to your walker to walk. So we need to get you another adaptive device, such as what we call a hemi walker, where you can use your one good arm to help give yourself some stability. Now, if you don't need that much stability, then we could go to a quad cane or to a single point cane to give you the stability you need so that you don't fall. Next, we want to talk about the exercises that we want you doing the first 4 weeks after surgery. We want you to start with some ankle pumps. Okay, moving your ankles up and down. We want to activate the calf muscles to keep any blood clots from forming. You've had surgery, you're inactive, the odds of getting a blood clot are higher, and so we want to keep the muscles pumping to keep the blood flowing to prevent blood clots. Now, the first exercise we want to consider is activating the shoulder blades here. You're going to be in a sling, but we want you to just squeeze your shoulder blades back and forth to activate these muscles. Okay, let's go ahead and turn around. Have a seat. The next exercise we want you to do is to bend and flex the elbow. Okay? We don't want you lifting any weight whatsoever those first few weeks of surgery. And so you're going to do this without any weight. It's just the weight of your hand. Okay? Next, you're going to turn your palm up, turn your palm down, back and forth with your elbow bent. And then you're going to do your wrist down and up to keep those forearm muscles activated. Then I want you squeezing your hand, opening it, back and forth. Okay? And if you have a little sponge or a little sponge ball, you can, like a Nerf ball, you can work on squeezing it as well. Okay? Next thing is doing some finger coordination exercises to keep those fingers activated and functioning. Now, the next thing I want to show you is what we call pendulum exercises. And that's where you're going to come out of the sling and we're going to bend over a counter, usually like a kitchen counter or a bathroom counter. We want it so that when you're bent over, your body's almost horizontal. Okay? And you just relax the arm and let it dangle. And then down here while it's dangling, you're just going to do some real gentle movement, some little circles. And you can go both ways on the circles, both directions. Okay? And then you can go across and out this way, and you can go forward and back this way. Okay? We want you doing those every few hours during the day, just for a couple minutes. Now at 4 weeks, between 4 and 6 weeks, there's some other exercises we want you to add to your routine. The first one is some resisted bicep and tricep exercises. So you're going to hold on to some TheraBand that your therapist will give you. Okay? The other hand is going to hold for the resistance, and you're going to pull against the resistance, flex the elbow. Okay? Next, to do the tricep, you're going to hold it above while you turn your hand and push down. Okay? And then the next thing we're going to add to your program is you're going to grab your wrist and you're going to gently start pushing your hand against resistance. It's called an isometric exercise. An isometric exercise is when you contract the muscle, but there's no movement. So 4 weeks, we're going to start this as well. Another thing we want you to start doing is very gentle. You're going to hold on to either a stick or a wood spoon or something. You'll use your other hand to help guide the movement, and we only want you to come out no more than this far, okay? No more than 30 degrees. But I want it gentle and pain-free, absolutely no pain when you're doing it, and just go to the edge to where it stops and go back in. Do not go beyond that point. The first 6 weeks, you're not going to be trying to actively raise that arm yourself, okay? However, we can have you start lifting with assistance, but only to 90 degrees, only to here, no further. So you use a cane to help raise your arm. You're not to do it on your own power, okay? And now you can go sideways and do the same coming up to the side. Again, no pain when you're doing this. Be gentle. If there's any pain, you back off. You don't go as far, okay? If that means you're only going this far, that's all the farther you're going. You be gentle and just go as far as your body will allow. Prior to 6 weeks, you'll probably be in physical therapy, and they will be moving your shoulder for you and helping you and giving you directions as well. After 6 weeks, you'll be allowed to start moving your arm on your own, but not prior to that.